Good morning. So we all know the last day of the conference is always the best day, so thank you for being here this morning. I'm going to introduce our panel today, and I'm going to start off by a little reflection of the last 2 years. We all recognize that COVID has exacerbated the polarization of public opinion, the mistrust of government, misinformation, platforms that spread misinformation, and public health has been right at the center. So we have a long way to go to bridge the divide, to rebuild trust, and to rebuild trusted messengers. But we're all here, right? Because we know philanthropy can play a powerful role in leveraging our own credibility to be trusted sources of information, to leverage our funding to fund trusted messengers, particularly in communities of color, to leverage our funding to fund journalism at every level, local, regional, national, and to fund journalism led by and written by people of color, and to leverage our funding to fund polling and research to better understand public perception and public opinion. We spent some time this morning in the reproductive health session talking about wanting to have a long game, right? We have short-term immediacy and a long game, right? And I think for many of us, funding journalism hasn't necessarily been at the forefront of our minds. Some of us, it has. And so thinking about how we insert ourselves into that role over time. And even better, right, if we can do that together, coordinated across local, regional, national funders in this time, across red, blue, purple states. So to help guide us in this conversation this morning, we have three vulnerable speakers, venerable, thank you, speakers, not vulnerable, journalists, academics. They're going to give us their wisdom and keep us motivated to be in this space. So first, we have Joanne Keenan, who is the Commonwealth Fund Journalist in Residence at Johns Hopkins Bloomberg School of Public Health, where she also teaches about the changing political and economic landscape of the U.S. media and what it means for public health. Jocelyn Kiley is Associate Director of Research at Pew Research Center, where she primarily studies public opinion on U.S. politics and policy. Marilyn Werber-Serafini is the Director of the Health Policy Project at the Bipartisan Policy Center, and she is also an adjunct professor at Johns Hopkins University. And of course, today we will be moderated by our favorite GIH CEO, Kara James. Can you help me welcome them to the stage?
All right, so we are here to talk about mistrust and misinformation, and particularly like philanthropy's role in this space. And I thought, Jocelyn, maybe you could start us off and just frame where we are as a country and how this has changed over time and how we've gotten to this point.
Sure. So I'll start, the theme of this session is mistrust, misinformation, and the political divide. And I think we need to start with the political divide, right? I don't think anyone in this room would be surprised to hear me say we're a deeply polarized country, and that polarization has grown substantially, not just in the last couple of years. Really, we can look back over the last couple of decades and see the roots of this growing polarization. And we can see it in a number of different areas. I could talk about this for a very long time, so I'll try to be very brief, but essentially, if we think about it just in the context of issues and policies and political values, you can look across those all kinds of different dimensions and see in virtually every part of our political space, Republicans and Democrats are further apart than they were 20 years ago. Issues like abortion, of course, but also issues like immigration, racial and ethnic inequality, the role of the government in safety net issues more broadly. We really do see over and over again divides that already existed are wider than they once were. And that's true, of course, among political elites, right, in Congress and state legislatures, but it's also the case in the public. That's one piece of the divide. Another piece of the divide is that the composition of the parties, the partisan coalitions, are very different than they were 20, 30 years ago. And by that I mean you can look at this in all kinds of different demographic ways, but a shorthand that I often point to is, and I think it's often surprising to some people, 25, 30 years ago, white, non-college educated voters were the majority group in both the Democratic and Republican coalition. Today, white, non-college educated voters are a majority of the Republican coalition, but they're about 30% of the Democratic coalition. So, and certainly these two dynamics are related, and they reinforce one another. And then the third pillar of political divides and political polarization I'll point to is that we've seen over the course of this time partisan antipathy. And I don't think it's a stretch to find examples of this, even in the last 24 hours. We can see the impact of growing partisan antipathy, of Republicans and Democrats being more likely to have negative views of one another. And all of that, I know, is not directly what you all are working on, but it's the backdrop against which you're trying to achieve a lot of the goals that you all have. And then I'll just dovetail that with trust. We're also, at the same time, in an era of what I call, we're mired in a low trust environment. We can talk about it in the context of trust in government, but it's broader than that. It's also affecting trust in other kinds of institutions like higher education, like healthcare, like even businesses, certainly media. But this is another dynamic that I think sometimes people are surprised to know, that we've really been at this very low level of trust for about 15 years. And if I had a slide, this is one of my favorite slides to show, because we actually do have data on trust in government going back about 60 years. And we're nowhere near the highs of the 1960s, but even if we go back to the 80s and 90s, trust in government was much, much higher than it is today. And how that relates to polarization, there are any number of ways, but one is that, of course, they reinforce one another, right? In a highly polarized environment where the stakes of what happens in government really are huge. When there's a change in regime, you're less likely to trust government when the quote-unquote other side is in office. And again, it has tremendous implications for the kinds of information that people seek out, who they trust, whether there are trusted sources. And I think that frames a lot of what we're about to talk about in the rest of the session. So I will stop there.
Can I just add that a lot of also we talk about trust of journalism and the media. So we have people. Anybody who's on social media can see certain people are reading this, certain people are reading this, but these people are not reading this, and these people are not reading this. And there's been such an enormous growth in what people are not sure. Is it an opinion from a blogger? Is it a piece of media from a trusted news organization? They don't know the source of what they're reading, yet they're reading it. And anybody who writes something on social media that is misinformation, it is a lot more likely to spread like wildfire than someone who is putting something out there that is factual. I think that they're talking about the numbers for the vaccines are 2/3 of the vaccine misinformation that's out there actually is rooted in 12 individuals. That's the number I keep seeing, and it's hard to believe.
So, and this is all good, and we are not gonna, I'm just letting people know now, we are not gonna delve into every single thing because we'd be here all day, and I know some of you might wanna catch planes, right, tomorrow. But so it's really important when we think about this trust, and I wanna get to the media piece of this, because at the same time that we've seen this erosion of trust in government, in higher education, we've also seen an erosion of local media. And so how how are these related, the mistrust and the misinformation?
This is where I live, both because I am still a working journalist. I led the health team at Politico for 10 years, so everything we covered every day was something controversial, healthcare in Washington. But now I'm also at Hopkins, and I've actually developed a course on the changing economics and politics of American media, local and national, and through the prism of public health. I teach it with Josh Sharfstein, two MPH and PhD students. When a local newspaper dies, and local newspapers are dying right and left, they're called news deserts. You can Google it, you can see the map. A lot of it has been done by the University of North Carolina. They've researched it. When you look at the map of cities and counties and towns that no longer have a local newspaper, zilch, that map will look very familiar to you. It's not identical to, but it is very similar to the vaccination map and the Trump voter map. Not 100%, but the broad contours are. When a local newspaper dies, it is not just, oh, we don't get the box scores from the high school sports. It's not just, I don't hear about the garden club. It's not just community bonds, and I'm not undervaluing the importance of community bonds. That's also important. But a news desert means it hurts democracy. And there's research, it's not me spouting off. It hurts democracy. It hurts voter participation. It hurts voter awareness. There are many famous examples, but a congressman under indictment in the Buffalo area, and naturally he was indicted for insider trading in a pharmaceutical company because, healthcare. He was reelected because they found that most people without a local newspaper didn't know he was indicted. He never served because he had to resign. It also affects municipal finances. They go up. Spending goes up. When somebody comes in and starts investigating, and there's some great examples that we probably don't have time to go into, maybe later I'll give some, they find corruption. There's a lot of corruption because nobody's watching. Nobody's watching city council. Nobody's watching the school board. All sorts of self-dealing and bad stuff happens. And when a pandemic comes, there's no local media. There's nobody local that you had trusted, including changes in local TV, because people 50 and up still watch local TV. So you created there was this vacuum, and the disinformation dozen, which Marilyn referred to, and all their friends fill that vacuum. So disinformation and misinformation travel faster than accuracy, and there's a void. And we saw, it's not just, I think that, Marilyn and I met when we were both covering health. She's a former journalist too. We've been friends for 20 years. We were reporters on the Hill together covering healthcare. There's always been distrust. Well, there's always been disagreement. There's been a bit of distrust, but we're now not a bit of distrust. Now we're at hatred.
And regardless of that distrust, it's, as Joanna's saying, there still are very important aspects of having the news out there. People may not they may say, oh, I don't trust your organization, I don't trust your news organization, but the upsides of having it there are huge.
Right.
And so, Marilyn, you mentioned the dozen who are putting out this information. The internet, social media means that instantaneously we've got misinformation out there. And you talked about trusted sources, you each talking about trusted sources. When we think about where people go and how that varies by community, it's not everybody is looking at the same things for their information. So maybe let's start with how do we counter this instantaneous misinformation?
How do we
counter the instantaneous misinformation that's out there?
So one of the things I'll say is that we know some of this, but we need more research to determine how people are getting their information, which communities are accessing which kinds of information and why. And that is a way to start to get at this, because we have some information, but we really don't have nearly enough to understand the problem. Which communities, and why.
I'll also add, I think an important part of this is when we talk about misinformation that comes out of social media, there is a group of people who are on Twitter all the time or on Facebook all the time who are directly consuming that information. But as much, there's this sort of second order nature of that information, that someone sees that information and transmits it in more conventional ways, right? In interpersonal networks, right? So when we talk about news consumption, it is still the case that a lot of people get their news from friends and family and social networks. And that, you know, links back up with the local news desert problem, because the closer an information source is to a person, right, to a community, the more likely it is to actually people be able to put a face to a name, right? And we see it in government, right? People trust their local government more than their state government, the state government more than the national government. The same dynamic is true, I think, with media. And so to bring it back to social media, I think one solution potentially to the impact of social media is to build up these other types of information sources, local news, but also thinking about other ways to create, to combat this at the community level.
I mean, I think as Melanie said, it's becoming a big field of research. There's a difference between misinformation and disinformation, although if you repeat misinformation enough times, it becomes disinformation. Misinformation is you're wrong. Disinformation is you're intentionally wrong. You know, misinformation, and that's a problem also as local news evolves, as local news erodes, you don't have health reporters, you have fewer people specializing, and even if a small paper might not have had a full-time health reporter, they may have had someone who covered health education and social services. Now they're covering 12 beats. So, you know, the experts, someone can make an honest mistake, but then it gets perpetuated. So for those of you funding, there are lots of resources to help train health journalists, and there's more that some of us are involved with developing. But the other thing is, I mean, I don't think we understand I mean, I think the reason why so many, both think tanks and universities, Stanford being a huge example, are studying disinformation is we're not sure how to counteract it. One, I mean, obviously rebuilding media, strengthening media is part of it. Strengthening expertise in healthcare is healthcare reporting is part of it. I would give you one really simple bit of advice for those of you who do live in social media is don't retweet something wrong. Don't retweet it saying this is wrong, because don't give them don't feed that, whether it's whatever media you use. You can see something going on, and you can say in a separate tweet, instead of retweeting them with a note saying this is wrong, you're spreading it. You're still spreading it. So instead of spreading it, you start a fresh tweet or a fresh Instagram post or whatever you do and say, I see this being circulated, and here's why it's wrong, here's why and then give cite a reliable source. Yeah. I mean, I think the really basic problem is, and this is something in my class, I make the students get outside their media bubble. They are forced, they are required, they are graded on watching and reading things that they don't normally watch and read, because what I tell them is, if you're in public health, whether you're in a research lab, whether you're a quantitative person or whether you're a public-facing official, you know, communication is your lifeblood. I mean, what public health does is change social norms and change behavior. Not all, but a lot of what public health does. And you can't only communicate to the half of the country that agrees with you. You have to figure out how to reach the others. And that's where I don't think any of us have all the answers. We don't have any universally trusted figures. You know, in the 1950s, when little kids were getting polio vaccines and teenagers were not, Elvis got out and got his shot on camera, right? And it worked. I mean, it's not only because of Elvis that we defeated polio, but it actually helped. And we don't have anybody. I mean, even Dolly Parton failed. Like, we don't have a single person in this country that everybody trusts. I mean, we all thought of Tony Fauci as like Mr. Trustworthy from, you know, AIDS and anthrax and everything, and all of a sudden he's radioactive. So the divisions, and the other thing is healthcare has been politicized since at least the 1930s, right? FDR didn't even try to deal with healthcare. You know, arguably back to Teddy Roosevelt 100 years earlier. You all know that healthcare is politics. But what's happened now is public health has been equally politicized, and people get killed because people die.
And so that's why it's absolutely, I mean, look at the MMR vaccine because of one flawed study. And right. It was, you know, everyone knows that this was a flawed study. for
Not just flawed,
decades, we had a
complete garbage.
right, right, but because of that, we had more than 2 decades or 2 decades of, you know, people continuing the misinformation that, or the disinformation that the MMR vaccine can cause autism. And vaccines for kids went down for 2 decades. We had worse numbers. But one of the problems is if we know right now where the sources of distrust are, so where are the sources of trust? And who can we actually focus on to relay this public health information? If it's not Anthony Fauci, who we all thought was the most trustworthy scientist in the country, then who can we trust? We know people trust their doctors. We know that they trust their faith leaders. We know they trust their educators. And so these are areas, and I'm not saying we shouldn't be working on journalism and working on media outlets to make sure that reporters and editors who are on a ridiculously fast-paced news cycle for the most part, many of them do not get as deep into the issues as they used to. They are writing incrementally to get their story out first. So we do need to educate the media. But I would also say that right now we're going to have our best success in educating and getting trust to, focusing on those people who are already trusted. The American Medical Association just came out with, or recently came out with, a statement that they want accountability for providers who are misspeaking. They want licensing boards to be able to impose penalties for, promulgating misinformation.
So let's pivot in the remaining time that we have, and in a few minutes I'm going to open it up for those of you who may have questions, and we'll get to that. But let's pivot. We've got a room full of health funders and philanthropy. How do we, and we want to leave on a positive note, so how do we move forward in this space? And let's talk first of all about bridging that divide. How do we work well together, and where are you seeing that people are working well to address some of these issues and just cutting across the chasm that we have?
I think what Marilyn said was a point something I've written about, is that if you're funding, vaccination was mixed, right? I mean, the Southern white high school Trump voter still is not vaccinated, but we made huge strides in some communities that were very, very, very skeptical at the beginning, got vaccinated, right? So we didn't do as well on boosters, but those initial 2 shots, we closed a lot of the racial and ethnic gaps, or came very close. In some cases, better than the rural whites. In many cases, better than rural whites. And that was done because we reached out to all the people that Marilyn just cited. So I think really broad-based, you need a national campaign, and you need a local campaign, and you need a hyper-local campaign. People trust doctors. Not everybody has a doctor, right? That's a whole other story. Churches, getting a mobile van, if people can't get to if you live in a place that doesn't have a CVS or a Walgreens, then get CVS or Walgreens to come to the local church. So churches, community leaders, local athletes can be political too, but sometimes it depends on the town you're in. The Boston Red Sox got people to sign up for Omnicare, so that worked before there was Obamacare. I think the religious figures are really important. Schools, to the extent that they're limited, but they're also trusted.
Limited.
But of course, everybody who's trusted is now being undermined by somebody. We're in the state, which is doing a great job of that.
Yeah, and it's not just educating about the vaccine. Is it good? Is it bad? When do you wear a mask? Does a mask really help? But it's basic health literacy. We have a real problem in this country with people having sufficient health literacy. And this is where educating the clinicians to listen to their patients, to talk to their patients in language, the most basic foundational language that everyone can really understand about health literacy. So the most basics of health literacy, also the vaccines. Really providing them with the information that they need.
But I think it's a broader issue than that, because you started with, people who can't distinguish between opinion and, fact. And so how do we teach that? Because it's not just do you understand the vaccine, or do you understand the side effects of whatever medication or whatever, but it's also, do you know that what you're reading on Facebook or Instagram or Twitter or whatever is someone's opinion as opposed to something from a reliable, trusted source that's accurate?
Yeah.
Yeah, well, I'll say a couple of things. I think one, that part of, the collective sigh that you heard with that question is, I think there's a lot of good research that says the thing to do in that situation is not to tell people that they're wrong, that's not effective, right? And so, and I think I was going to make a broader point, but I think it relates to this, that, this is a little issue dependent, but really trying to engage with people on their terms. And so, I know that a concern for many of you, a topic that's not just about health, but certainly has health implications, is, say, climate change, right? I think it's those words are very polarizing, right? Democrats believe in climate change, as do many Republicans. I don't want to imply that it's really solely partisanship, but many people are concerned about pollution in their water, concerned about air quality and water quality, and is their area going to flood? And a lot of those things are related to climate change. So think about the ways to engage in these topics at a more granular level, at the kind of pre-polarization level, is another way to think about. Break down the topic and find the common ground, or find the angle that your skeptics, are willing to engage on, I think is an important angle.
I totally agree. I work for the Bipartisan Policy Center. We were created 15 years ago by 4 former Senate Majority Leaders, 2 Democrats and 2 Republicans. And we make a practice out of that, skipping the polarizing language, skipping sometimes the actual polarizing issue, and getting down to what can we actually agree on. And this brings me to another point, and that's convening. Bringing together people of opposing opinions to really sit down and talk to each other. Because when they do, we've seen this in practice. The result is very fruitful. I didn't look at it that way. I didn't understand this. And hey, maybe we can actually work on this part of it together. And that's really important. So I would say convening, and I agree, looking past the polarizing language. And that's where education comes in. Education of reporters and editors to not just go with the sensationalized headline, and not be a part of the problem, frankly.
And that's a fight that editors have with the headline writers all the time.
That's exactly right. It's
my daily
part of the problem.
I mean, when I sort of wanted to remember what I wanted to say here, my little mnemonic device, I had 3 things. One is funding media, which I think we'll maybe come back to, funding research, which we may also come back to, and my 3rd one was baby steps, and which is like in a community level what they're talking about. Find something really anodyne, find something plain vanilla that you can find people who may disagree with you. No offense to anyone who really loves vanilla, I like chocolate, but find somebody in the community who you really can't normally work with. Not someone who wants to shoot you, but someone who is really, really away from you. And find something small and safe Maybe it's building a park, you know, so that kids can get exercise and fresh air in a safe way. You know, maybe it's sidewalks, because you know, the health world gets, you know, fights diabetes, and the business world gets pedestrians walking in front of their stores. Something small, something productive, because once you agree and work together on something really little, maybe the next baby step is a toddler step. We're not going to fix this overnight. I mean, the plummeting of trust has been dramatic, intense, and frightening, really frightening. And, you know, I used to sort of look at my colleagues who were covering the campaign and the abuse they would take, really, really horrific. And I would get a little of it because healthcare is political, but I wouldn't get what they get. And then start writing about vaccines, you know, you wouldn't believe some of the stuff I get. And so I do think baby steps, even if you think, well, I like the big impact, you know, I'm a funder, I want to make a splash. I think a little baby splash is maybe part of our way forward.
So with that, let's invite the audience into the conversation. We have 3 ways for you to participate, and if you want to go to the microphone, we have a microphone here. We also have, if you want to raise your hand, we can bring a microphone to you, and for those of you who are joining us virtually, we welcome you to send a question in via the chat, and we can incorporate those in. And as we're getting those up, one of the other things that I wanted to ask you guys about, you know, so we've talked about I like your mnemonic of the research, the media, and we're building those up, and philanthropy's role. Government is not trusted. You know, I've worked for the government for 8 years, and, you know, we never would say we're here from the government, we're here to help, and people go running away, you know. What is the role of public-private partnerships, and how can, you know, so funders help to foster trust in some of these other institutions that we've seen this erosion in?
Again, sitting down together, funding, supporting convenings, small convenings, not public. If you have something that's public, people are going to feel like they have to say something because of who they work for, who their constituency is, or such. But if you get people in a room together talking, public and private, I think you're going to start to come to, and not just one meeting, you need a series of discussions where people can really let down their guard and start to understand each other. And I think that's how public-private partnerships are going to be born.
Great. All right, let's start here at the microphone.
Buenos días. Mi nombre es Lourdes Rodriguez, and I serve as Senior Program Officer for Women's Health at the St. David's Foundation in Austin, Texas. Thank you so much for creating a space to start building trust. I find that we lack public spaces where we can meet our neighbors, the people that we don't know that are not like us. So my question is, what's the role of social infrastructure, public spaces, parks, plazas, sidewalks, libraries, in helping me meet the people that don't look like me, don't think like me, so that we can start building those connections and start then thinking about the sources from which we get our information. So the role of social infrastructure, because some of us may not be funders of you know, media or communications, but we may fund social infrastructure.
I think that's baby steps. I mean, I don't mean to use baby steps in a pejorative way, but I mean, I think what I mean by baby steps is things that are your starting point. And I mean, things around children's health tend to be children's health, children's education, children's well-being. I mean, it's sort of easier to get some bipartisanship around kids as long as you avoid a growing list of you know, hot buttons. But I think that can be an area that you can bring different communities together in. I mean, I was just in Austin a few weeks ago. It seemed like a really good place to go write about contraception, given what's going on in abortion. And you know, I think I've been sort of trying to train myself as I go places to pay attention to who's where, because I'm now working part-time in Baltimore, and it's really, you know, it's a very divided city, and I've been trying to see where I go somewhere else, what does it look like, you know, is Baltimore just fresh to me and I'm seeing things? What do other communities look like? So I understand what you're saying. I mean, but again, I think those finding, you know, convene, you know, get people in a room over something that's cherished by as many different partners as you can start small.
I like that you mentioned kids, because who doesn't bond over kids and pets? You know, the dog park.
Oh yeah, the pandemic's been really great for puppies, you know.
I also will add, I think that would be baby steps, but a real challenge is, right, that as with the rise of the internet and the rise of, we community in different ways than we used to. So, so I just would think, as part of that, think about the way to actually actively foster those connections, and they don't have to hit you over the head that there's a meeting here, but you know, as you said, you mentioned the dog park. You're right. People bond over their dogs at the dog park. But how many people go to dog parks and don't know the names of the owners of the dogs? Right? There's not
the names of all the dogs.
They know the names of all the dogs, but the conversations don't get below that sort of surface. So
True.
So the question is how to, you know, that's a baby step, but how to try to turn it into a deeper community connection. As well, and it's more challenging. Many of you probably know the book Bowling Alone, right, and the follow-ups from that, and so that's another undercurrent to a lot of these dynamics. That's a real challenge.
My question there would also be, if you're creating a space for parents with kids to get together, aren't you doing that in your community, and aren't those the people you already know? So I'm no expert on this. I'm not sure what the answer is.
I talked to someone in Detroit who did, from the Muslim community in Detroit, which is it's unusual, and it's isolated from other communities in Detroit. And they did a lot of work with health fairs and free screenings and stuff. I would probably leave vaccines out of it for now, but that brought a lot of different people to, that wouldn't normally, it's a one-shot thing. It's not gonna solve all the problems, but then again, you get people who you don't normally work with or meet, and maybe you find 2 people out of the 20 that come who are your next step.
So I'm going to combine, we've gotten 2 questions virtually, and I'm going to combine the 2 because I think they're very much related, which is, you know, given the role of social media and, you know, sort of harm, misinformation, what can health funders do to help counter that specifically? And you've already heard, you know, there's a myriad of things that funders fund in health. And so for health funders specifically, what can their role be in countering the misinformation, particularly on social media?
I really think that, I'm going to go back to something I said a little earlier, and that's the very rapid news cycle. Reporters these days, it's not like when Joanne and I started out in journalism, I won't say when, but they're required to file so many stories in a day and get it out first at all cost. And what that creates is an environment where you're getting part of the story in one little news bite. I'm not saying all journalism is like that, but you're getting a lot of that. And so you're often not getting the whole story in one piece of information. You also have reporters who no longer have the time to really learn the issues in depth, and to understand the nuances and the various details. So funding trainings and education for reporters to step back and learn more about what they're writing about in general, I think will help them when they're writing that little thing. Maybe they'll put in a little something about, you know, how it hasn't always been this way, or you know, their efforts to do X. Maybe there'll be a little extra something in there because they have the perspective that they learned through trainings and education that is out of their daily news cycle.
I think that, you know, right now there's some really bad journalism, and there's also some really fantastic journalism. Yeah. And in some ways we're in whatever the opposite of a golden age is. I don't know what the word would be, but the non-golden age of really, you know, there's a lot of lousy stuff out there. There's a lot of misinformation. There's a lot of stuff that's wrong. For 10 years, I'm quite involved with AHCJ, the Association of Healthcare Journalists, which many of you fund. And one of the things I did was I was what they call the topic leader, and I would write tip sheets and examples and blog posts and so forth about health reform. And I would always, I would try not to just say, oh, this is a great story in the New York Times. I would really look for local stories. I would really look hard for local TV stories. And I'll tell you, there are days when I spent like 3 days trying to find something interesting and accurate. And I couldn't, that could be an example to somebody else. And on the local level, I sometimes just couldn't find it on a certain topic. But we also have, I mean, you've seen some really remarkable work. I think that what I said, I was at Politico for 10 years. And political people, you think of it as politics. We also really built up, unpredictably, we built up the biggest policy newsroom in Washington. I ended up with, my health team had more than 20 people on it. So we sort of did, we fed the beast. We did this boom, 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 instantaneous reporting. We also did deep dive enterprise stories. And, when the pandemic broke, it was our record traffic. I mean, that people came to Politico for news about the pandemic showed my 10 years of work had paid off, right?
Yeah. But the one thing that people need to understand very quickly is that journalism, for the most part still, is a business.
Yeah.
And it is struggling financially. So there isn't the money to allow journalists to do the kind of deeper dive pieces of work that we really do need. So we still have some of that going on. Some of it is foundation funded. But we also, in addition to educating reporters who are doing the boom, 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 we do also need support for reporters to take a fellowship or to just support a program within something to allow the reporters to do the more thoughtful pieces.
Yeah, I mean, but
All right,
the
so,
fellowship
hold on.
model doesn't
I'm gonna-
work anymore.
Because we're running out of time.
Okay.
I've got 2 people in queue, and I'm hoping I can get both of those questions in, and we give sort of brief responses so we don't keep people here. Okay.
Hi, my name is Derek Coy with the New York Health Foundation, and I'll try to be quick. I know the numbers changed, but I think most Americans want a single-payer health system. They would prefer for veterans to have access to VA, a lot of other issues that are bipartisan and in the war in Yemen. So my question is, does this lack of trust in government come from the inability or the actually not having a representative democracy? And can we quantify that that's where that distrust comes from?
No, I think that the trust, it's complicated. Again, we could talk about it for an hour, 2 hours, where I would push back a little bit on the single payer. That is definitely not a majority position in the public, and definitely more supported among Democrats than Republicans. So, but I think trust comes from a number of sources that I think some of it is actually what people see when they look at government is a lot of partisan fighting, and sometimes they just want things to get done. But I also think the information environment and changes in the information environment have created a environment for more distrust. Again, I know we're short on time. I could talk about this in much more depth. So I think it's much more complicated than that is what I would say. But what I will say is, we're in an era of low trust in government, but when you ask people about specific things that government does, you find much more mixed opinions. There are things that people like that government does, and they say government does it well. So we're not actually in a place where nobody wants the government to do anything. It's just that people's views of government are very complicated, but people don't like bureaucracy. They don't like, it's far away, particularly the federal government is far away from them. So there are a lot of different dynamics at play. Yeah.
And I would say most people don't actually know what government
Yes,
does.
that's a component too.
Keep the government out of my Medicare.
Keep the government out of my Medicare.
Right,
yes,
there's
that is a
misinformation
perfect
about what
example.
government does.
Yes, yes. Okay, last question.
Hi, Caroline Brunton from the W.K. Kellogg Foundation. First of all, thank you. I'm a big believer in investment in media. My mom worked for a newspaper for a very long time, so I appreciate everything that media and journalism does. I guess my question is about, we've talked a lot about what I would call micro-level investment in journalism and media. but I think that there's more to the infrastructure here. Obviously, there are some, you referred to the dirty dozen with vaccine mis and disinformation, but there's broader ecosystem of mis and disinformation. Where are some systems level areas where we can address to help combat that? Because I'm not sure that if we just have more media and more journalism, that's going to be enough to drown out the mis and disinformation.
So there are a couple of things. One is there's a bunch of research, both foundations, think tanks, and universities are all expanding research, some things that are already announced, some things that are in the pipeline, on how to really understand and fight back against misinformation and disinformation. So you could put your money there. I would also I worry a little bit about everybody, a lot of reinventing the wheel, that it has to be coordinated, it doesn't have to be one program, but I don't think everybody giving someone a grant to study the exact same thing in the exact same way. I'm not sure exactly what the coordinating mechanism should be, but there needs to be one. And as a subcategory of this, there are public health schools that are doing this. So if you really want to look at disinformation in healthcare, there's a bunch of places. The second thing is, instead of funding like one local newspaper, there are organizations that I think that the little independent the startups, they need lots of, it's not good to have one single source of funding. Create coalitions and make sure they have a variety of sources, both for sustainability and independence and objectivity. But there are also organizations that are working with, there's a whole lot of organizations. There's one that's called Lion, which is, I forgot the actual acronym, but it's an online news organization. There's INN, which is the Independent News Network, which has more and more cool and exciting things starting every single day. I'm on all these emails and I feel more I can't say I feel hopeful, but I feel less pessimistic. Yeah. There's training programs. I mean, Marilyn and I are both trying to develop some that are new, that fit in the new ecosystem. So I think that there are ways, particularly if you put things together that are national or regional, not just writing somebody necessarily for one. I mean, a lot of these little news outlets, a lot of them are going to fail, and some of them are going to change the world. And let me look at ProPublica.
And some of these organizations are already trying to do this. So we already have some efforts underway. The Association of Healthcare Journalists, the Society of Professional Journalists. There are different journalism organizations, and Joanne.
National Association of Black Journalists. National Association of Hispanic Journalists. I forgot the exact acronym, but there's a Trans Journalist Association. There's a Gay Journalist Association. There's Asian American, there's and they work together. I mean, my newsroom,
National Press Club.
There's UNC Annenberg Center. There's lots of people working on this. There's lots of people. Not all these ideas are going to work, but please. I mean, it's public health and democracy are both at stake, and they both need your help, right?
So, in a closing word, we've talked about a lot of things in this short session that we really could have had a full conference on, but we talked about media, we've talked about misinformation and disinformation, we've talked about trust in communities, we've talked about what do we need to do at a systems level, we've talked about talking to other people who we don't agree with and how we can start to make those ripples as we take our baby steps. So, what's the one thing as you look ahead in both this immediate space that we're in, and we haven't even talked about November, but in this immediate space that we're in, and then in the long term, because we've been talking about the long game, what's the one thing you would think that we need to be focused on to really address this challenge of misinformation and mistrust in our country?
Okay, I'll start. I think the most immediate thing we can do to help is to focus on the trusted sources of information. If I had to pick one, again, the clinicians, the faith leaders, and the educators, those are people we're already trusting, and if they're hearing it from them, I think some of this other stuff, I don't think it's going to go away, and I think that needs to be addressed too. And then convenings, getting people together. Sorry, I had that in.
Yeah, and I guess I would double down on what I said before, which is I think if you're looking to make progress on any of these things, the more granular, the depoliticizing the conversation can be, and I think, and that means I think really thinking about not your bubble, but all of our bubbles, and the language that we use to talk about these issues can sometimes, all of these issues can sometimes really put some people on the defense. So really thinking about what is the best way for me to come to the table and talk about these things in a way that brings them in rather than puts them on defense. And again, it'll take different forms for different issues. But
And I agree. I mean, I've said what I think the funding priorities, and I agree with both of them, but I would just say you have to be in it for the long haul, that our country is really in bad shape right now, and we're not going to fix it easily, and it's going to take hard work for many years, and it's going to take finding optimism within yourself, even when you look up and only see clouds. I think that's just what we have to do, is keep putting one foot in front of the other, and it's a long path.
Thank you. I think these are great words of wisdom to end on, and I think particularly, Jocelyn, for those of us, whatever we are passionate about, we recognize that people are on a continuum in these journeys, and there's some of those who are really far ahead of us and some who are just stepping in, and we need to create the space to welcome people into that continuum, bring them along if we're going to make the lasting change that we need. Please join me in thanking Marilyn, Jocelyn, and Joanne